You're watching CTOM TV. Knowledge is power.
So what are off-label cancer treatments? An off-label drug, in short, is a drug that was approved for one type of cancer or one type of condition and has been then used in another without having approval in that type. So it's an FDA-approved drug, and it's been used for, let's say, breast cancer. And then later on, let's say a scientist or a doctor will find, well, that drug targets the PIK3CA mutations in breast cancer. But I have a patient here now with a colon cancer that has mutations in that. And so what they'll do is they'll apply that same drug that was designed for breast cancer to that colon cancer patient and find out that it actually works great. So we do know that a lot of these drugs, in fact, almost all of them, are able to be used across different cancer types. And so if you're seeing an oncologist that is experienced in one type of cancer, they're not going to know what sort of treatments or drugs that are being used in other cancers could potentially be used in yours. So that's an important thing. And it's important that oncologists are trained in every type of cancer and don't just specialize. I think specialization is really slowing down the application of different drugs to different cancers.
Mm-hmm. On that note, in certain countries, remember that thing back at the PET CT slide that were 23 out of 28 in Canada for diagnostics. In certain countries, the UK comes to mind, they actually have they have the medical oncologists who are on the front line prescribing and monitoring how the treatment's going, but they also have like science-based oncologists who are tasked with gathering some of this information and assisting the medical oncologists in making these decisions. And I'm excited to see that. I think that is the way of the future, and it will help take care of some of these problems we're talking about today.
Thank you for watching CTOM TV. Subscribe below and stay informed.